you're going to see sharper than this, like maybe twice as sharp, but it's going to take a month. Okay, so because the prescription is so bad. So you'll see light glasses and contacts in about 10 days. Because you're minus 10, it's like maybe 1 day putting out there. And you probably will see better than glasses or contacts in about a month. We've published a series of like 200 eyes on this.
Okay.
It's because we're getting rid of the minification, and we're also doing line cutting.
Okay.
Okay, so you want to say hi to your friends?
Hey. How you guys doing?
Hey Joseph, how long were you thinking about getting rid of your glass or contacts?
I was looking, it's going on 5-6 years.
5-6 years, huh?
Yeah, went to Moadel's. They rejected.
Do that, right?
Yeah, they rejected me.
They rejected you on
Yeah,
Moadel.
and then I went to another place.
Yeah.
And they called Moadel's for the records. And they said absolutely not.
Absolutely not. I know.
Then what happened was, what excited me was that Dr. Chynn was, from what I understand, was on Dr. Oz. And I thought he was maybe, I said, he's in California somewhere. Then a good friend of mine, Damien, told me about, there's a doctor here that does no flap.
Yeah.
I said, the only one that does that is Dr. Chynn.
Hey, you're right.
Yeah.
And he goes, well, he's right across the street.
Oh, that's crazy.
I thought I was going to catch a heart attack, and I ran over here. I ran here, and I actually spoke to the girls, and they said yes, he does it. Yeah. And I was like really excited when I met him.
Yeah, you see the Mets, right?
Yes.
Joseph, every time I saw you here, like in the free console and so you on the street, you looked like very nervous about it, very anxious.
Well, because minus 10. Not a
were you nervous about it?
Yeah, I was nervous about a lot of things that were going to happen. I guess the anxiety, because I suffer from anxiety. I just wanted to get it done because it's a blessing, and to have Dr. Chynn,
because
Dr. Chynn.
The minus 10 is essentially not functional. Right?
Not really.
So like minus 2, minus 3, you can get by. Minus 10, you can't do anything.
Now, looking back in perspective, is this easier than what you thought, or
yeah, actually, yes, it is. My heart was pumping out my chest when I first came here. I said, feel my heart. He was like, oh my God.
That was like a piece of cake.
Yeah, and you know what? With situations like that, there's a lot of people that change their mind, you know, coming from across the street in the background that I have. You know what? It's either do or die. You're either going to take care of it and see what it's all about, or you're not.
All right, because you're military.
Right, so you know what? Let's get it done. Whoever wants to go out there and do it, I recommend this, Dr. Chynn and his team.
Thank you.
To get it done.
When I saw you 2 hours ago, you asked me, oh, I'm very nervous. I said, listen, Joseph, I don't think you're as nervous enough for us to use nitrous oxide or laughing gas.
Right.
We use that for very nervous patients. But in your case, with just the volume or
you were fine with the volume.
You were perfectly fine.
Yeah, I was fine with the volume, and at the same time, I said, you know what? I said, let me be brave. I don't need the gas. I said, and I know I'm in great hands, so
that's important.
That's very important to me. So it was it's great to see. I feel like I got my glasses on.
It's crazy, isn't it?
Yeah, it is. It's awesome.
And it's going to be like twice as sharp in a month. You're going to be like incredibly happy.
Yeah, I spoke to this one lady. She tells me, you know, there's a middle part. She goes, but don't worry about that. She goes, because you're progressively, it's going to get better and better.
I mean, this is the worst you're going to see for the rest of your life. So most people like you, they're like, hey, this is pretty good, I'll take that.
You know, let me ask you a question. Right now I'm seeing like halos.
Yeah, that's normal for the first week. Because you have no skin on your eye, your skin's going to grow back.
Oh,
so that's what takes about a week of this procedure.
Okay.
The cutting procedure is a bit quicker, but we couldn't do that anyway.
Not on you.
I think the best thing is that we talked to a few clients that
It's
already had
I think it's helpful.
cheapest done. I actually, that's great.
You know, we're the only center that blends the pre-ops and the post-ops because we kind of want a more honest discussion. A lot of centers just keep the post-ops on Mondays and Tuesdays and the pre-ops on Wednesdays and Thursdays. They try to separate them. I don't think that does anyone any good. In other words, if that girl says, well, you know, it was a little itchy, scratchy for the first few days, I kind of want her to say that. So it's like, we want the truth.
She said it was great. She said she's
well, one thing Dr. Chynn has that he is very transparent. Actually, whatever crosses his mind, he has no filter in terms of, oh, I don't know if that's going to be well perceived. He will tell you right away Joseph, if you're not following directions, he will not be nice to you, because being nice is not helping you to get your best vision.
You know,
he will tell you Joseph, and he will tell you exactly what you're doing wrong and how to prevent that. So that is very important when it comes to
noticed when I
surgeon.
first met Dr. Cheyenne, Dr. Chynn, and I thought he was kind of mean, you know. But you know, learning with what you have, if the person, the boss, the person that gives you directive, and you can't go follow that directive, then technically, hey, listen, if you can't do the job, then I really don't need you here, you know. And that's a thing that I learned throughout the years. This is a great man.
Plus, you have to select between a good, mean surgeon or a bad, nice surgeon.
Yeah. No,
I'd
rather have the mean guy,
yes.
because the mean guy is like, we're going to get this done and we're going to do
absolutely.
it right.
Yeah, when I shape up the people aren't doing a good job, even if the person is the patient.
Yes.
But look, they're making stuff together.
I see you clearly. I see you like if I have my glasses on.
That's crazy, right?
That's great.
Yeah.
Wow.
You're going to be so happy. You're going to see, by New Year's Eve, you'll see better than you ever did with glass or contact.
Can I ask you a question?